Researchers who study long COVID are calling it the post-pandemic pandemic, but the province's public health department says it's not responsible for dealing with it. Long COVID is when a cluster of symptoms persists long after an initial infection of COVID-19. Now, Janice Fitzgerald was the face of public health through the COVID years. Here she is in spring of 2022.
It's something certainly that we are going to have to look at. There's no doubt about that. I mean, I think for some people who get COVID, it's more than just a respiratory illness, and it can affect other parts of the body, you know. So we certainly are going to have to look at how we deal with long COVID.
But jump forward to 2023. It seems something has changed.
It's public health in the sense that the public's health is affected, but it's not public health in terms of what public health does.
So what changed? NL Health Services says it's working on joining a national clinical trial related to long COVID. Depending on the number of participants in that trial, it says it may consider options like a long COVID clinic. But just how big of an issue is long COVID? Here's what one expert had to say.
So I often call it the post-pandemic pandemic. It affects a lot of people. We know that it affects approximately 15% of people, with about 1.3, 1.4 million people across Canada. So it is not a small issue.
So yeah, that's a lot of people. Physicians and researchers who study the condition say it's affected tens of thousands of people in Newfoundland and Labrador since the beginning of December 2021. Stacey has had long COVID since 2020. She says the government should take people like her seriously.
It is something that lasts with a large proportion of people, and not acknowledging it is not only discarding the people that are going through those hurdles, but it is also creating a problem.
Stacey says the public needs provincial information and resources about the condition so that others who do have long COVID no longer have to suffer in the dark.